Beyond IRCAD. Surgical Journeys.
Hello everyone and welcome to Beyond IRCAD, the podcast where we dive deep into the lives and careers of successful surgeons from all around the world. Recording from the IRCAD studio in Strasbourg, France, and we have a remarkable guest on the show today. His practice is focused on percutaneous surgery and HPB surgery, but you'll see that he's done much more than that. Professor Mariano Giménez, thank you so much for being with us today.
Good morning, Grace.
Good morning, thank you. So it's a great pleasure to have you on the show, and today we'll be talking about you and about your journey as a surgeon. So let's start from the beginning. You're from Argentina.
Yes.
Can you tell us a bit about your background, where you're from, and what it was like for you growing up in Argentina?
Well, I study medicine in the School of Medicine in Buenos Aires, and my degree was in later in my residency in surgery, in general surgery. When I finished and we moved to a staff, the chief of department of surgery in my hospital said, Mariano, is a new thing in the end of the 80s. I am very old. In the end of the 80s, said something to make surgeries through the skin with a catheter or something. Is in that time is not balloon, not stent, not body, only catheter. Said it's interesting. I think these people in the United States are a little crazy, but it's interesting. And for that reason, I obtained one scholarship in the Mayo Clinic and another scholarship in the University of Buenos Aires, and moved to United States for 1 year in the Mayo Clinic and the University of California in San Diego too, and look all the new possibilities in the imaging guide therapies. When I returned to Buenos Aires 1 year later, my chief of the department of the university hospital said, okay, Mariano, talk me about your experience. Well, my experience was interesting because it's new possibilities, and said, okay, fantastic. And which is possible organize one section in the Department of Surgery about that. And what is the name of this new thing? And said, interventional radiology. And the chairman of the Department of Surgery said, sorry, Mariano, but it's totally impossible because it's another department, power, money, etc. I returned to my home. I cried with my wife. I said, I lost 1 year of my career, of my life. And my wife is not medical doctor, but is more smart than me, said, change the name. Said percutaneous surgery. I said, but the name is not good because at the end of the day, all the surgery is through the skin. I remember very well, one Friday, talked again with my chairman of the Department of Surgery and said, and in case I open one section and the name is will be percutaneous surgery, and he said, fantastic, you start next Monday.
Great.
And at the end of the day, in the first moment was the same of the interventional radiology, but with another name. But at this moment, really, it's a percutaneous imaging guide procedures, imaging guide surgery. And we use more surgical techniques, and we combine techniques of laparoscopic, robotic, and percutaneous, etc. For that reason, this change to the department changed the history of this part.
Okay, so we can thank your wife for the name, percutaneous surgery. So this is how you got into these specialties, but can you remember maybe if we go a bit further back in your childhood, or was there like a specific event or maybe a person around you that got you interested in medicine or surgery?
Well, always. I remember some people said, well, it's a moment. No, but I remember all time. I mean, 5 years old, and said, I will be a surgeon, not a medical doctor, surgeons. I don't know why, because it's some psychological problem. I don't know. But all time I said, I will be surgeons. And in the School of Medicine, in the second year, I start in anatomy, because the anatomy is too related with this, it's very close related with the surgery, of course. And we continue with all my friends of that time of the anatomy in the 80s. And really, well, I continue all my life in the same way.
Back then, did you have people that you looked up to, mentors that motivated you?
Well, yes, of course. The mentor is essential in your professional life.
Yes.
With two characteristics. First, the mentor is not something to obtain for you one position in the hospital or something. No. This is a chief or something. The mentor is something which has the specific advice in the specific moment, and it follow you in one part of your academic life or professional life. I had two mentors in my life because in different moment of your life, you need different person, different mentor, different characteristic. My first mentor was the first chief of surgery, is a Professor Santiago Pereira in Buenos Aires. He's passed away 15 years ago, and I remember he very well with the sentences. Professor Pereira all time said the center of your activity in the 80s, the center of your activity is the patient, is the disease of the patient. It's not important, I am surgeon, I am radiologist, I am gastroenterologist. The important is the patient. And now, 35 years later, is essential. Why? Because in the 80s, for one disease, you have only one possibility of treatment. But now, for one disease, for one problem, you have a different approach. And in case you visit, you are not medical doctor, no? You are not medical doctor. In case you visit one surgeon, it's possible the surgeon said, the best option is my surgery. Or the radiologist said, is my puncture. Or the endoscopist said, my endoscopic approach. And really, it's not true. Because depend of your comorbidities, your disease, your problem, your psychology, different things. For that reason, it's important the center of your problem and your environment, and your family, and your social context. And it's necessary said, for you, the best option is this, or this, or this. Later, my second mentor was Horacio D'Agostino in University of California in San Diego. Later, Horacio D'Agostino moved to the chairman of the Department of Radiology in Shreveport, Louisiana. Professor D'Agostino is a very, very interesting guy. He is surgeon and radiologist, both. And is super expert in interventional radiology. In that time, to Buenos Aires, to California, the different time is, I don't remember, about 3 or 4 hours. And in some moment, he called me and said, I have one moment to talk with you, and said, okay, perfect. I remember this conversation about the future, about the possibilities, about I continue in that time in the 90s about all of these procedures, because in that time, all these procedures, only few people work in these areas. And my third mentor is Professor Jacques Marescot. He's opened my mind about the thousand of possibilities in the future.
Wow. Well, I think your mentors were people who were very skilled, but also didn't have an ego problem. I think you were talking about the human aspect.
Yeah.
Is ego a problem in surgery?
Yes. The ego is a problem for the humanity, but more in surgeon. The most important thing, because the ego is not a good thing, it's only bad things, is necessary to work with the possibility of the empathy, the idea not to the say okay with the diversity, because it's not it's not a good thing. It's said to make the benefit of the diversity, because the diversity today is not only a good thing or ethical thing, it's necessary. Mm-hmm. You need work with the teamwork, and the teamwork is essential, but into the teamwork, you need the empathy. It's not only with the patient, with the family of the patient, with the social activities, into your teamwork. and incorporate people in your teamwork with a totally different of you. Because in case you create one teamwork with people and all the people has the same north, the same idea, the same qualities, it's possible it will be perfect to drink a beer or something and fantastic. But for the medical activity, it's a disaster. You need people totally different in your teamwork. It's not easy. It's not easy to work with people different.
So if somebody disagrees with you,
yeah,
it's actually a good thing.
Exactly. For the increase the power of the teamwork and the effectivity of the teamwork with the patient, because at the end of the day, it's the center of our activity. But it's not easy. It's not a good thing at the moment, no?
Yeah, it's never easy.
No?
I think inside the operating room and outside, probably. So when you step into the operating room,
yeah.
Do you prepare in a specific way that makes you, confident?
Several things. First, several papers show the non-technical skill in the operating room is more important than technical skill. Incredible. Said the communication, for example, with the nurses, with another member of the team, the surgical team during the surgery, is more important than a specific technical stitch or something. Of course, all is important, of course.
Yes.
But the communication is non-technical skill, the relation, the
human aspect.
The human aspect is essential. The other thing is at the moment of the surgery. When you make one part complicated in your surgery, and you, for example, need to cut one artery, of course, it's your decision and it's your moment. The problem is the surgeons, and it's possible related with the ego or different reason or for this. We have a success with this, our only vision in one moment of the surgery, and we use for years the same structure before and after of the surgery in our families, in our life, etc. It's one of the reasons, I think so, but I'm not sure, in medicine, the surgeon has a very high divorce or something, or not a good problem in the family. It's possible for this vision.
Okay.
Of course, it's in the School of Medicine, we talk about the diseases, about the techniques, about the approaches, but not talk about this aspect. And these aspects are very important. Work with mentor with this characteristic. For me, in my life, was essential my three mentors, Pereira, D'Agostino, and Maresco. People with very incredible mental criteria. The mental open. I said, which is the best thing. And the problem is not possible to obtain all of these activities in 1 day or 2 days, in one course, in one congress. You need to talk with these people, this mentor, several times, it's possible weeks, months, years. Now, we work in Argentina and Latin America. We organize one mentor and leadership program for 50 young surgeon endoscopists or radiologists, is the same for us, in Latin America. And during 1 year, super expert in different fields, 9, talk with these people online, and in one moment is on site. We have a conversation and lectures and chat and opening discussion about not about the specific technical aspect, about the leadership, about the model leadership for the future, about the possibilities, about the importance of non-technical skill, the diversity, the empathy, etc. And really, we are very excited with the idea. We start in 2024, and because the idea is to create a community, transnational, trans-specialization, not only one surgeon or radiologist, and create a team of friends, but it's not close friends, but knowledge about the people in different countries with a similar age, with the base in the new leadership for Latin America. Work with the people of my age is too old. It's not easy. Yes, we need to work with the next generation, with the people less than 50, less than 45.
I know you don't like to be called that, but you are a mentor in many ways, because you spend a lot of time passing on to the next generation of surgeons. How does it feel to be in that position of mentor and role model? Is it important to you?
Yes, of course. One of the problems of the people work of mentor said, because I am God. And at the end of the day, in case for you the mentor is related with the ego,
yes,
and you talk about the ego, please run. It's not a good mentor. It's a disaster. It's not good for you. Or people with mentor is toxic. Said that it's necessary to run the toxic people, because it's not possible to change these people. I think we need and the characteristic of the mentor, something at the end of the day they said, in my opinion, is only my opinion, I don't know if it's good or not, the best way for your question about your specific moment of your future is this way. But it's important, the mentor said, in my opinion, with my point of view, this way is better, because it's possible it's not a good thing, it's not true. You understand me?
I do, yeah.
Because every generation is different to the previous one. I'm not exactly of my parents or my grandparents, but I am totally different to my children, because for the technology, the generation changed very quickly and more. Of course, I work a lot, I work with the young people, I work in the new technologies all the time. For that reason, I think my vision is 2023 vision. But I'm not sure. I'm not sure about that. For that reason, it's important always said, this way is only my vision, but check. Always check.
Yeah. You were talking about the importance of being driven and focused in the operating room, but to be able to be a bit more relaxed and open-minded outside of the operating room. Is that something that's challenging for you?
It's a little different to understand for people not surgeon, but the best moment and the more relaxed moment in our life is the operating room. For me, is the moment I'm totally relaxed, and it's fantastic because nobody call me by mobile phone or something problem or etc. Because when you have more age, you have more non-medical problem in your medical activities. And for that reason, is the moment I'm totally relaxed and I'm fascinated. I 100% focus in the problem. For that reason, is in the operating room is no problem. Outside is different. For example, I live 50% in Argentina and 50% in Strasbourg.
Yes,
it's two totally different scenarios, two different countries with good things and bad things. And in Argentina with a lot of economical problem. For that reason, outside the surgical room in Argentina is more related with the economic problem. For example, for these patients, we discuss with different specialties about the best approach for these patients. But something said, but it's not possible to obtain the stent or the grasper or something because it's too expensive and it's not possible at this moment in Argentina. Said, okay, well, what is the second best option? Well, this is the second best option. For the reason is, is different. Of course, all this discussion is not exist in France.
Yeah.
Thanks God. The other problem is similar in the both places. For example, is the pyramid structure. In case you work in the pyramid structure, near to the tip is more fight and the base, of course. And this is a part of the life. But it is similar in Argentina and in France.
Do you think that traveling so much, because you travel, you live part of the year in Argentina and part of the year in France, do you think that's had an impact on your way to perform surgery directly, to have different perspectives?
Two things. First, about my both activities. The key of I have to continue my activity in the both place is the teamwork, because I build is ego, the teamwork fantastic in the both places. In Strasbourg is for research, is a small team, and in Buenos Aires is for assistance, for research and for teaching. For that is bigger. Our teamwork changed in 2020, before the pandemic, 2019, 2020, when we resolved with all the staff who work with me, the new fellows, because in Argentina we have 8 fellows per year, 6 for clinical and 2 for research. It's a lot of fellows.
Yes.
And in the past, I decide alone the fellows. And now all the staff decide for the new fellow. And my vote is 1 and the other vote is 1. And was incredible the difference. The level always was good, but the level of the fellow and the activity was increased. Why? Because a different vision, different things, and really was a change of the teamwork. For that reason, my teamwork is not I organize. We organize the new teamwork. The only problem, in case you have 2 teamwork in 2 different places with 5 hours different in the both, is when I finish my activity here, around 5, 6, 7 p.m., I start with my activity in Buenos Aires to the midnight. And when I moved to Argentina, some people here, friends, organize meeting 9 o'clock in the morning. It's no problem. The only problem is 4 a.m. in Argentina. For that reason, this is the only problem.
Okay.
But for example, I organize my round of the patient in Argentina at 7 o'clock in the mornings, and it's a noon time. It's during my lunch. For that reason, here my lunch in Strasbourg is in my office with the Zoom meeting.
I understand. So you live part of the year in Argentina, part of the year in France. How did you end up working here in Strasbourg, and how did you meet Professor Jacques Marescot? How did that happen?
Well, it was an interesting story. It's in relation with the teamwork. In 2015, Professor Marescot has finished, and really finished in 2016, the ISU, the Imaging Guide Surgery Building from the IRCAD. In one IRCAD course in Brazil, in one dinner of one of the courses, Professor Marescot in the dinner has front with one of my staff. And Professor Marescot said, oh, and now I finished this new building with this new idea of the hybrid OR with the machines to CT and angiorobot, MRI for surgeries, etc., etc. And my staff, Dr. Mariano Palermo, said, you need to talk with my boss. And it was incredible because one surgeon work in the some specific area, not said, you need to talk with me, you need to talk with my boss. And Marescot said, it's possible, this team is a good team. For that reason, I received one email of Professor Maresco and said, well, in March, I will visit Buenos Aires for 1 day, and I love the idea to work with you and your team all day, and during in the evening, make one lecture for your team. I said, wow, the first thing is real, this, and the second thing, come and work with us 1 day. He came to Argentina, work all day with us, with the different procedures, etc., lecture with my team, and he talked with my team, and when finished, said, okay, goodbye, and returned to France. 1 month later, I received one invitation to make a talk in IRCAD Barretos, and 1 month later, another talk here in Strasbourg. When finished my talk, said, okay, visit the new building or something, and it's good. I said, really, it's amazing. This building of the ISU is only 3 in the world with this characteristic. I said, well, it's Disney. It's a Disney for surgeons, for surgeon working images. And said, okay, we organize one scientific director of percutaneous surgery here. And I said, of course, yes, but I continue with my activity. And he said, okay, no problem. And really, we start with all of this new activity in the both places. And really, I think continue in Argentina was good for me and was good for the institution here. Why? Because one of the characteristics of the innovation is the create a new things. And create a new thing with all function well, and the idea to return to Argentina, we need the innovation to survive in medicine. We need, because every month change the rules. It's not good for the coronary, it's not good for the life, but it's good for innovation. For that reason, it's open your mind with the idea to create the new things. And here, Strasbourg, for Maresco, is the place in the world with the new thing in surgery are planning and are created.
I know that Professor Maresco speaks very highly of you. Do you think that this camaraderie that exists between surgeons also helps to enhance surgical knowledge and education?
Yes, it's essential. All of us are different, and all has the possibility to make something for the team. It's necessary to say, your point of view is different of my point of view. I'm not sure you are true or you are wrong, but I support you. And this is important because it's possible good idea. In case the good idea was good, we continue. In case not, it's with this chart. But the problem is when the leader of the mentor has, but in case your idea is a very good idea, the people talk more about you more than me. And this is a problem. Which is the problem? The ego. Again.
Yeah.
But when you has some moment in your life and your career, or for example, Professor Maresco, it's easier. Because Professor Maresco is really in another level. You understand me?
Yeah.
For that reason, some people with the Maresco level decide only live the life. And Maresco said, no, we continue, we increase the possibilities all time.
We were talking about the human aspect of surgery as well. I read something about you while I was preparing for this podcast that I thought was quite impressive and unique. As a member of the AHPBA, you've done several humanitarian missions as a surgeon. Can you tell us a bit more about that?
Yes, this outreach mission was organized in the a little more than 10 years ago for one professor of surgery in the United States, a past president of the society, Professor Gassi Sibari. I remember in that time, 10 years ago, I talked with Gaisibari, said 1 week in one city or one country with a lot of difficulties, etc., is only 1 milliliter of sweet water in the ocean. Totally wrong. It's totally different. Mm-hmm. The structure of the outreach mission created by Sibari is 1 week. You work 1 week in one city. Of course, it's not in Buenos Aires. It's in one small city or medium city in one part of the region with economic problems or something. During this week, you perform surgeries, but not alone, with the HPV people of the region together. And the other thing is you talk with the nurses, with the young surgeons, with the community, with the politician about the importance of the good quality surgery, good quality medicine for the population. And in the afternoon and evening, some internal course for the community of the people and the medical doctors, etc. Really, it's a fantastic experience. I had outreach mission in Kurdistan during the ISIS war, 40 kilometers to the Mosul at the moment of the Mosul fight, and the refugee camp, etc., and the city of Duok. And in Guatemala, in Honduras, in 2 times in Peru, 2 times in Bolivia, one of these time in the jungle of the Bolivia jungle, and another in the mountains of the Bolivia, and 1 time in the Imperatriz, in the border with the Mato Grosso in the north of Brazil. And really, it's an incredible experience. For me, because I changed a lot of things, and the relation, I understood different things, etc. And for the people and the surgeons, and not only the surgeons, radiologists, endoscopists in these cities, the relation with the expert of the visit during this week is amazing. And I continue my relation with the academic relation and with the clinical case, etc., with people with a visit, for example, in Kurdistan 10 years ago or 8 years ago, and really change the history of these cities. Of course, it's not resolve the problem 1 week, or the problem continue, but the view of the problem. For example, very common is said, okay, this is the problem of this patient, but I know it's possible some robotic or something, but in my country it's not totally impossible. For that reason, I need make the surgery the same of the 50 years ago for economical problem. Well, the idea of this outreach mission said, no. We discuss about the best possibility of treatment of this patient. And in case it's not possible, we said the second one. In case it's not possible, the third one, the fourth one. But the idea to discuss all these possibilities opened the mind of the medical doctors and said for the authorities and the politician and something, no, I need, of course, it's possible, no, I need a robot, but I need one mechanical suture for the surgery. I need something not too expensive, but it's possible to change the history of this disease in this patient. Because in case you said in your mind it's impossible, you use the scalpel alone, and the scalpel alone was 50, 60, 80 years ago, but not now.
Has it been emotionally difficult at times? Because you were talking about you were in Kurdistan at a time of war and conflict, and you were in areas where access to quality surgical care is more difficult. So has that been emotionally difficult to witness that?
Yes, it's true. It's true. It's difficult, but for example, in specific about the Kurdistan, the level of medicine in Kurdistan is amazing. It's a very good level, and the level of the physician is very high. It's very high. In my mind, before my trip, I said, well, it's one region in war or something, but no, really, it's amazing, and changed my point of view about this specific region. You understand me?
Yeah.
It's changed. It's opened my brain too. For that reason, I think it's not the good name of said humanitarian. I prefer outreach or something, or mission, but not humanitarian, because it's not a gift. Because the gift is possible, my gift, but I receive a lot of gift too. It's bidirectional.
Yeah, yeah. So what advice would you give to a young surgeon, or any surgeon for that matter, who would consider doing an outreach mission?
Well, first is necessary to make some expertise in one part of the field of in our case, the HPV, because it's not, this outreach mission is not to make and training. The idea is people with a very high level training, not in my case, but other, visit some specific place. For that reason, this outreach mission is more related with the people with a very strong experience in one specific field. The second thing is, for the young people, is talk with another young people with the same vision about the medicine. Because I know in some young people, has more in Latin America, it's possible, but around the world is similar, is some young medical doctor, young surgeons said it's not possible to localize one leader and one mentor, and we have economical problem, a problem with my family because I work 17 hours per day, etc. And there was a decision in this moment with all of this question. He said victimization. Said, oh, the problem is with me, or the problem is the life is not good with the victimization is not a good solution for the problem. The problem is that, yes, it's true. All of this is true. It's not something in my mind. It's true, but some people, a lot of people, has the same problem with me and make bad idea to fight for the good medicine. And it's possible to localize leader and mentor which support me in this fight. And some people has the possibility to help you to cross the barrier. It's possible.
Okay.
And finally, about this is the life is not easy. It's during our conversation, Chris, and really I talk a lot about me. It's not a good thing.
No, it is.
It's good for my ego, but it's not. But we talk about my success in my career. But I have the possibility to make 3 or 4 conversations about my failure in my career. But the important thing is Carlos Pellegrini is the past president of the American College of Surgeons, Argentino, of course, said different things. But the first one said, you need something to support you outside the medicine. One friend, your wife or husband, something. In my case, it's my wife. Mm-hmm. And said, when you have one problem, and in your career you have a problem 100%, support you. And said, okay, go, continue, cross the barrier, something. And this is an important thing. The other advice of Carlos Pellegrini is localize one target in your life. Very high, because more high is more easy to view, to objective. But the important thing, and the third thing is, the important is the way, it's not the objective. Because it's possible not touch the objective, it's not important. But it's the way, and the way is your life is the most important thing.
The journey.
The journey, exactly. The journey is the important thing. And the other thing he said is the boat are more safe in the port, but the boat are created for the sea. For that reason, is made the journey. Is sometime will be good or sometime which is not good, but it's alive. Finally, he said, is the important in your life the mentor, but the mentor only to say, well, this way is better than this way, in my opinion, no more than this.
If you could be in a room with the young Mariano Giménez right now, just starting out as a young surgeon, what would you tell him?
Wow. Work, work, and work. Live the life, not fight. Because in case you fight and win, you lost. And use the time for work, your family, your friends. At the end of the day, the most important part of the life is the family and friend and the close relation, and the work is fascinating, but it's not the only thing in your life, but it's an important part in your life.
What do you do outside of the operating room to clear your mind? For one thing, do you manage to switch off completely?
I'm not a good example about. I'm not a good example about that because of course, is my vacation with my family. My family, of course, is all very old and very activity or something, but we have 1 week or a little more than 1 week all together, always, at the end of the year. In Buenos Aires or in Uruguay, but all come for the different part of the world and come with us and read the books. But really, is my relaxation is continue with my work. For that reason, I am not a good example.
Okay, because you were saying this is when you feel the most relaxed in the operating room.
Exactly. For that reason, is I'm not a good example. I think in case I have the possibility to change something in my life, I think it's more time for my friends.
Okay.
I work a lot with the time of my family, but I resign a little my time with my friends. It's possible I continue a little more.
Okay.
The other thing is not for this last part is not for the young. For the not too young, is said. Is with a new project all time. When you stop with the project, it's possible you die.
Yeah, you have to set new goals all the time.
Exactly.
Yeah, it's great advice.
And it's not in relation with the hospital, with the position, something different project.
Yeah, absolutely, that's great advice. Professor Mariano Giménez, thank you so much for being on the show today. It was very, very insightful, and I'm sure our listeners will learn a lot from this podcast. Thank you.
No, thank you for the invitation.
Stay tuned, guys, for more episodes coming your way very soon with new guests. Thanks to all the listeners worldwide, and see you guys next time.